Good morning. My name is Olivia. I'm known as Olivia K on Facebook. I am Ollie K on Instagram, and I am Warm Yam 9800 on Reddit. And I am usually on these platforms to help out nursing students who are getting through nursing school, and also our need to take the NCLEX and need pointers and tips to help out. So today I am going to talk about positioning. Why am I going to talk about positioning? Because I have mentioned in the past that fundamentals is what people should pay attention to, as well as your high yield content. So what people don't understand, or what people fail to understand really, is that when it comes to positioning, it is very important to NCLEX and people need to pay attention. Why? Because it is part of what's called the basic care and comfort, and I'm telling you, you do better on your positioning. Your basic care and comfort scores will improve when you're taking the test. So I'm going to talk about these few positions in which people need to keep in mind when studying for the NCLEX. So for example, this is your high yield, the high Fowlers. Why is that important? Because I've mentioned in the first video, like the not first video, but in the first versus best and critically thinking video, that it will improve lung expansion. Don't mind me, sometimes I get tongue-tied. It improves lung expansion. So it is ideal for patients who have impaired gas exchanges, such as COPD, pneumonia, or left-sided CHF. So this is also ideal for patients who are also having the NG tube inserted for the first time. Then I want to talk about Trendelenburg. So I did briefly mention this positioning before. So with a patient who is hypovolemic, it's going to be ideal because the legs should be elevated to help with increased blood flow to the vital organs. So if you look in a video or diagram, the legs will be like up here like this where my wrist is, and then the head of bed would be down like that. So you don't want it to be all the way like that. That's then we're getting right to the territory of that poor guy that died in the Nutty Putty cave. I don't want everything about that. That traumatizes me a lot. But anyways, this is the ideal patient position that this patient should be in. It will definitely improve, and then that's usually what's recommended for a hypothermia patient and blood loss. Okay, the sideline position. So this is especially important when a patient is just had their liver biopsy. And what people fail to realize is that the person should be in the right lying position. Why is that? Because it's going to prevent hemorrhaging, and the liver is a very vascular organ. That's what not many people can realize, but that's really where a person should be. Also, if a patient has seizures or they have a high risk of aspiration, they should be on the sideline position, so that way the person doesn't aspirate and vomit, and when they're vomiting, the fluid can come out. Great. Semi-Fowler. So this is in some notebooks, or not notebooks, but some textbooks, I'll say that's your number one positioning for a respiratory patient. But in this case, if a person has mild respiratory issues, such as a mild case of COPD, a little bit of mild dyspnea, that's ideal for them. Also, a patient that is post-op and who's recovering, that would be the perfect positioning, so they're resting. And also to keep in mind, this positioning, semi-Fowlers or even high Fowlers, depending on, this will be for your ICP patients, but they must be mid-line. So that's a key thing. This position is ideal, rather, because it promotes drainage from the increased fluid and pressure from the brain, and it goes down. So that's promoting it. And if they're going to be turned, they need to be turned side to side to prevent increased pressure to them. And last but not least, I would like to talk about the left-sided positioning. So anyone who has issues with maternity questions, please hear me on this. It is very important for the maternal patients. Why? Because it prevents pressure on the vena cava, and it also improves blood flow to the baby. So when you're dealing with patients that have remember your veal shop, right? Variable deceleration. So we recommend Lion. And what does that stand for? Left side position, IV, oxygen, and you notify the provider. So if you don't remember anything out of this video, at least remember that key important point. So if you remember these, sorry, I'm like flabbergasted. So you remember these, you will improve on the NCLEX, and you'll also improve when you're practicing your questions. So for more help with NCLEX tips or nursing school tips, leave a comment and like the video, and I will make more. So leave a comment on what you want me to cover next, and I will be glad to do so. Thank you and have a good day. Bye.